specialists.
Kristen's going to take a look at my nose, and then she's going to go ahead and spray a numbing medicine in my nose that helps to kind of open things up and actually numb up the surfaces. And we're just going to make sure that we start the process like we want to and help to get things going. Now we're going to go ahead and sneak the cotton balls in. These have a numbing medication on it and also a little bit of that decongestant medication. So that's going to help to get the surfaces further prepared on the inside of the nose. You know, there's a weirdness factor with something going in your nose, but it's actually not a big deal at all. And so now we're going to wait and let these guys kick in. Okay, so it's been about 20 minutes, and I've just had these guys sitting in my nose, and now we're going to go ahead and get started. So Dr. Rossiter is going to man the ship here. First step is just making sure everything's looking like it ought to. And then, are you doing the numbing injections?
Yeah, you can feel a little pinch here.
Okay, so I feel a little bit of a pinch, not bad. Pinchiness-wise, not much. Basically, literally feels like you are gently kind of pinching your skin. It doesn't really feel like a needle or anything like that.
You may feel your heart rate go up a few beats here.
Yep,
just briefly.
So I'm expecting that heart rate sensation to kind of ramp up. Starting to feel a little bit of a gallop. And then he's just sneaking the cotton balls back into place, getting a little bit more of that numbing medicine up on the surfaces up there.
Okay, we'll go to
Those
the right
guys
side.
are in, these guys are coming out. So left side's kind of cooking behind the scenes here. Right side will start up, and otherwise, sensation-wise, not a whole lot. Much of anything going on, which is good. So a little clickiness with either the camera or the numbing injection, but pretty low key, generally speaking. So once again, the cotton balls are going to go back in over here. All right. So now we're going to, those guys are sort of sitting on the surfaces, the numbing medicine's working behind the scenes. Now we're going to work up, you're going to do frontal.
Yes.
Yeah, okay. So now we're going to work up in that forehead sinus on my left-hand side. So I've had previous sinus surgery. I'm doing actually pretty darn well, so I'm not, you know, in a bad situation. But what Dr. Rossiter is going to do is find that natural sinus opening up towards my forehead. And I can't see what he's doing necessarily, but I can kind of feel a little bit, feels a little sort of pressury up there. And I can hear a little bit of action going on, otherwise not much going on. So he's finding my forehead sinus on the right-hand side. And now,
a little pressure.
So we're going to feel pressure. Feels like kind of little pins and needles up there, otherwise
and
nothing much
deflate.
going on. And I don't feel that coming down.
And pressure.
Coming up again. So I feel that same thing,
deflate.
little kind of pins and needles up in the forehead and going down.
A little pressure.
And once again, I don't really feel much. I can kind of hear that creaky sound. Otherwise, that's the sound of that sinus area
And
just kind of
deflate.
opening up. So now we're going towards the cheek sinus on my left-hand side. So we're just trying to get this natural sinus opening expanded.
Okay,
So I
let's
feel
do about 16.
a little bit of pressure here, not bad. And a little bit more. I can feel it kind of in my upper teeth a little bit, but not too big of a deal.
Let's do about 18.
So same thing, a little bit of pressure, more kind of upper teeth area, and but otherwise
deflate.
not too big of a deal. All right, now we're heading towards my right cheek sinus. So just feeling a little bit of pressure in my cheek. Actually, that one's a little bit more in my nose than my cheek right now.
And deflate.
But
And 18.
And once again, just a little bit of pressure in that cheek coming at me, and otherwise, not too big of a deal. So now a little bit more numbing medicine, just kind of making sure the, we're going to switch gears over towards more in the breathing passageways, so trying to reduce the turbinates. So in order to do that, first thing we need to do is make sure things are nicely numb still, and I'm not feeling any of that. which is a good sign.
Little smoke, little pressure.
So I can smell smoke, which is not really smoke, but it smells smoky. Otherwise, not a whole lot of action going on there. And I can hear it, but not a big deal.
Get a little pressure here.
Okay, so we're now going to try to push this guy a little bit to the side so that I can hear that kind of creakiness and feel a little bit of pressure. So now all done on that side. So sneaking the cotton balls back in, making sure we're getting that numbing medicine back on the surfaces. Other than the smell, I don't really feel anything. So again, just try to push this guy to the side, get him out of the way as much as we can, which is a good thing. So a little pressure, it's actually not bad. Now, we're just going to go ahead and sneak those cotton balls back into the nose again. And that's kind of the end of the procedure, which is good. So we are all done. It's actually been done for about 5 minutes or so. So now sitting up, I'm going to just sit around here. These cotton balls are sitting in my nose, just kind of hold a little bit of pressure, and they've got a little bit of numbing medicine and a little bit of that decongestant medicine to kind of help the surfaces settle down from procedure. Honestly, right now, I feel, other than having something in my nose, I feel absolutely fine. Like nothing just happened, which is a good thing. And the actual doing it wasn't, honestly, it wasn't a big deal at all. So it's actually, and I've done plenty of these, performed plenty of these, but it actually was less intense than, even what I figured it was going to be. So really, even for a pressure standpoint, not bad. The little pins and needles up in the sinus areas, the work in the inside of the nose, I didn't feel any of that. Numbing injections, I didn't really feel any of that either. So yeah, pretty darn good. So what'll happen from here is we'll have these guys sit in my nose for another 10, 15 minutes, sneak them out, take a look, and then just make sure everything's behaving itself. And then beyond that, what I'll do on the back end is really just keeping my nose moist. So a lot of saline spray, saline gel. I'll be rinsing as much as I can, just trying to keep things moving along. And really the other thing I'll do is just use an antibiotic ointment on the inside of the nose. Same thing. All that stuff is just trying to keep the lining moist and keep things moving out of there. I'll see somebody here in the office in about a week or so. Just suction out any buildup that might collect. So when the nose gets swollen or stuffy, I guess I should say, on the back end of procedure, the mucus doesn't move along like it's supposed to. So sometimes we just need to suction out any mucus that's wanting to kind of hang out in the nose. And then typically after about a week is when things start moving forward. And so first week's the stuffy phase. Once I get through that, then we should start gradually moving forward. And so what I'd expect to see is over the next month or so, most of the change is happening from a breathing standpoint. The sinus areas, we'll see how that plays. That usually kind of trails that a little bit. So over the next maybe month or two after the first month, we'll see what I notice up there. And again, I mean, just to kind of recap what I was feeling like coming into all this, I had undergone previous sinus surgery about 5 years ago. Last year or two, just a little stuffy, more on the left side than the right, more at night than during the day. So more just kind of laying down sort of situation. And so I wasn't having a dramatic negative impact, but I could tell it was a deterioration from where I had been a few years after my original surgery. So the goal today is just sort of try to keep me up and running and try to optimize the situation. So we'll see what that looks like. So I'm expecting sort of more subtle changes moving forward. And otherwise, I'm back to work tomorrow and doing my normal thing, and plan on working out tomorrow morning, and not going to hopefully miss a beat.
Because your quality of life matters. Advanced ear, nose, and throat specialists. Advent.MD.